What is the best drug for osteoporosis? There are a number of drugs currently being used to treat or prevent osteoporosis. The main types are bisphosphonates, teriparatide, and denosumab. Try saying those 5 times fast backwards. Bisphosphonates include alendronate or Fosamax, risedronate or Actonel, ibandronate or Boniva, and zoledronic acid or Reclast. You have no doubt heard that these drugs are great for reducing osteoporosis. But you need to understand a little concept called number needed to treat. Whatever this number is means that this many people have to take this drug for a certain period of time to prevent one of them from having the bad outcome, in this case, osteoporosis or fracture. In 2024, the American Journal of Medicine reported that 167 people have to take a bisphosphonate drug for 3 years to prevent one hip fracture. This means that the other 166 people get no benefit from it. But all 167 are exposed to the side effects and risks, such as heartburn, stomach pain, esophageal irritation, flu-like symptoms, and osteonecrosis of the jawbone. This last risk is why your dentist won't do anything that affects your jawbone, such as dental implants, for example, for 6 months after your last dose of one of these drugs. If you have dental work during that time, you have a higher risk of not healing. Next, you may have heard of teriparatide, or Forteo. This is an injection you give yourself every day. If 30 of you take it for 18 months, one of you will not have a fracture in your spine who would have had one. If 92 of you take it for 18 months, one of you will not have a fracture in your wrist, hip, or somewhere else other than your spine. But all of you will risk dizziness, nausea, headache, joint pains, muscle pain, high calcium levels, kidney stones, fainting if you stand up too quickly, and bone cancer. And you can't take it for longer than 2 years due to these risks. Finally, we have an injection you can get at your doctor's office every 6 months. It's called denosumab, or Prolia. You have to take calcium and vitamin D with it so your blood calcium doesn't drop too low. And you risk also infections, osteonecrosis of the jawbone, and severe bone pain. 21 of you will have to take it for 3 years to prevent one spinal fracture. And 230 of you will have to take it for 3 years to prevent one hip fracture. Next, we might want to consider cost. The bisphosphonates tend to cost between $10 and $200 a month. Forteo is $1,200 to $2,000 a month, and Prolia $1,700 to $2,300 every 6 months. Your direct cost with insurance may be much less. But don't fool yourself that God is picking up the rest of the tab. It's coming out of your wages, taxes, or the high insurance premiums you pay. I'm sorry to disappoint you. I asked at the beginning what the best drug is for osteoporosis, and I have failed you. I don't know what the best drug is. It seems to me that when you look at the actual data, instead of listening to the commercials on the television, no matter which drug you take, a lot of people have to take it for a long time in order for one person to actually get the benefit the drug promises. In exchange, everyone who takes these drugs risks some important conditions that shouldn't be taken lightly. Only you can determine whether the trade-off is worth it to you. If you are looking for real solutions to osteoporosis, call us at Prestige Wellness Institute.